a scarless approach to preventing cancer.
Medical reporter Dita Baer has more on a procedure local surgeons are offering as an alternative to a traditional breast surgery.
A mastectomy can be a life-saving operation, but it does result in significant scarring that can leave a patient struggling with body image and self-confidence. Now, a local surgeon is offering a robotic approach.
The patient, of course, is on the operating table, and those are the robotic arms that are attached to the little instruments that we insert into the patient.
Dr. Diane Drugas walked us through the robotic surgery lab at UI Health.
It gives better visualization. It's a 3D screen that the surgeon visualizes the surgical field with, and for areas that are hard to see or fit your hands in, it gives you better opportunity to do more precise surgery.
Traditionally used for pelvic and abdominal procedures, the breast surgeon is applying the technology to her line of work as an alternative to an open mastectomy.
Some patients really struggle with body image and sexuality and even depression. So the advantage of this technique is that it's virtually a scarless mastectomy. There's no scar at all put on the breast.
With a robotic approach, the only incision Dr. Drugas makes is a 2 to 3 centimeter opening near the armpit. From there, she threads a camera and instruments through to reach the breast tissue.
But the surgeon controls the arms with these little hand pieces that you see on the console. The gland is dissected from the skin like we do in a traditional mastectomy.
It's a procedure she's been perfecting for months.
There's definitely a learning curve. We're used to doing it the open way.
So far, she's performed 4 robotic mastectomies on patients who opted for prophylactic breast removal due to an increased risk for cancer. Faith Eismonger carries the BRCA mutation. Her sister does as well and is already fighting stage 4 cancer.
I seen what my sister went through and I'm like, I don't want to do this. I decided it was best for me to go ahead and have it done prophylactically.
With her sister Hope by her side, Faith underwent the robotic procedure in April. It took 8 hours, much longer than a traditional open procedure.
It takes at least 80 minutes longer is the average than the open counterpart, and some patients aren't medically fit to be under that long.
Unfortunately, the surgery lasted for 8 hours, but I think it was well worth it in the end.
Even with the extended surgery, the 49-year-old is relieved her risk of breast cancer is now much lower.
It really wasn't bad. I wasn't in a lot of pain. I didn't really take any pain meds or anything like that. Little scarring, which was great.
Christine Masterson knows what a traditional mastectomy feels like. She had the open procedure on her right breast after being diagnosed with cancer earlier this year.
I'm okay with the scarring. It's part of who I am now, and you know, it's a story.
But when it came to having her other breast removed to reduce the chance of her cancer returning, the veteran police officer opted for the less invasive approach in September. She says she's happy to share her story with others contemplating the robotic procedure.
In hindsight, it was better for me. It's less scarring, an easier recovery than the first surgery. There's always options.
Oh, I'm excited about it. I think it's wonderful for preserving body image and for recovery, and I think we have a lot to offer patients with it.
The robotic mastectomy is not yet an option to remove cancerous breast tissue, and Dr. Drugas says the procedure is best for patients with less breast volume, generally a C cup or smaller. So far, the complication rates appear to be comparable to a traditional mastectomy. Back to you.